There are many ways to increase the take rate of the fat that we are putting in the face. The most important thing is to make sure there is a high stem cell density. I use a very stem cell dense type of fat, which is very purposeful. That means I'm processing the fat in a very specific way to get the stem cell density high. The most common thing to do is to mix PRP. There's the most evidence behind it. But interestingly, fat does better if the PRP is not directly mixed into the fat, but the PRP is placed into the areas where the fat was transferred after the fat is already placed there. So it's a very different way to do it. It also gives me a very direct comparison of the fat that I'm putting in. I know that there's no other volume mixed into that. Things like photobiomodulating, which is treating the fat with red light. You can treat the fat itself or you can treat the recipient site. I'm also using fat on the face. This is another really big question. I had fat in my body and it didn't take very well, so I'm concerned it's not going to do well on my face. Well, that makes sense at some level. We also need to think about the face is incredibly vascular rich. It is a very perfect area to be putting the fat in. And when your surgeon does a really good job of using micro aliquots of fat, which means small amounts, and layering it throughout the different tissues properly, you're getting a lot of blood vessel contact with the fat that's put in there, and it's going to do very, very well there compared to other places like the butt or the breast or something like that. So you have the processing of the fat, the placement of the fat, what's mixed with it, how the fat or the area is pre-treated, and then the types of recovery that you're doing. These are all very, very key elements to ensuring fat transfer success.